everyone. Good afternoon to everyone's watching right now. My name is Nurullatifah. I'm the dietitian in Columbia Asia Hospital, Petaling Jaya. So first of all, I would like to wish selamat menyambut bulan Ramadan, happy fasting month to those who's fasting. And I hope that it all goes well for these first few days. Despite the whole COVID situation, and not sure if everyone managed to go to bazaar, but I'm sure a lot of people also cooking at home right now, or maybe buy something, but a lot of special food during Ramadan. So now we're gonna look into the topic, of course, regarding food, nutrition, and sleep. So we will see about like how certain food affects our sleep, or vice versa, how sleep affects our food, our mood, and how do we feel about it. So basically, if anyone has question, you can just pop it in the comment section, and I'll try to look into it and try to answer every questions that you have. All right, so without further ado, let's get started. Let me see. Okay. So first of all, we are going to go through our basic needs. So what do we need in general? And then after that, we will go into the kind of nutrition-related diseases, basically kind of diseases that can happen if we don't take care of our food, and how it is also related to our sleep. Okay. And then also after that, we'll come down to a few examples of how this food can affect our sleep, or how sleep can affect that food. And it's more like a vicious cycle, how one thing affecting another. All right, so for our basic needs, first of all, we want to see how many hours should we sleep? Because, like a lot of people say, we don't actually need that much of that many hours. Some people say that, average is this hour to that hour. So based on a few studies and then publication by Sleep Organization, they found out that newborn needs about 12 to 16 hours, toddler needs about 10 to 14 hours, teenagers 8 to 12 hours, and for all of us adults, we need about 7 to 8 hours average. So, but like what happened during we sleep? Why is it so important? Because there are a lot of other process that's happening when we're sleeping. But I'm just going to highlight the two of the process. Here is our brain is storing all the memories, and also all the process thought during the day. So it's just basically processing it. And our body also, a lot of metabolism, a lot of recovery, and everything happens during sleep. So that's why that amount of hours that I have discussed just now, that's why it's very important for us. Okay, so that is our basic need. Moving on, we're looking into what happens if you don't get enough sleep. So first of all, I think this is very obvious. When you don't get enough sleep, you feel like you're not thinking straight. That's because you're experiencing difficulties in thinking and focus. So on top of that, when you need to react to something, you would experience slow reaction time. Basically, it means that let's say you are driving and you're in the middle of the road, and suddenly there is a motorbike coming towards your way. So you need to react fast and try to avoid accident from happen. But because you have been not been sleeping very well, you have slow reaction time. So therefore, it's also a high risk of accident. Or if you are manning equipments, you're using machine. So all this, your reaction time towards certain situation is a lot slower than the usual. So we want to prevent this, because these are things that's preventable, but also we'll look into the nutrition part. And also for children, behavior and attention problems among children. Okay, for this one, if you notice, kids, they tend to have maybe throw tantrum, or they have behavioral issues because they're because parents are not providing enough sleep time for them also. So all of this generally what can happen if we all don't get enough sleep. Okay, the next one, sleep-related hormones. So why I just want to talk a little bit about the hormone side, because I would like all of us to understand that it's not just the matter of the sleep and then eat. It's a lot of things that's happening throughout the process that also is very important for us to have a little bit of basic understanding, because like once we understand that, we have the awareness of why this is so important. So the first one, the hormone that's called adenosine. This hormone, it's a kind of neurotransmitter that is in our brain. It's accumulated. But when we have a high concentration of this neurotransmitter in our brain, we will feel sleepy. So this is the type of neurotransmitter that we need in order to fall asleep. Okay, but so when some people are very, very sensitive to caffeine, that's because the caffeine can block the action of this particular neurotransmitter in our brain. So it's supposed to make you sleepy, but now it's blocked by the caffeine, so it cannot do its work. Okay, that is the first one. And the second hormone that's very important is serotonin. So this is the feel-good chemical. It presents when you're awake and when you're asleep. So when you're awake, when you are feeling good about something, you're feeling well, you're feeling energized throughout the day, that's because this hormone is high in concentration in you. But also when you want to go to sleep, this hormone is being used to form melatonin, so that melatonin can help you to sleep. So it's got two ways of how it's being used in our body. And the third one is melatonin itself. So this is hormone that releases when it's dark. So that's why when we want to go to sleep, we need to provide that cozy, comfortable, dark room so that we slowly put ourselves into that mood, because this melatonin hormone needs to be released. So it tells our body to sleep. So things like our phone, our computer, our TV, the one that produce lights, this can inhibit melatonin production. That's why a lot of advice say that, if you are trying to go to sleep, don't look at your phone about like a few minutes before you go to bed, because it can really disrupt the mood and how you're feeling. Okay, so that's why our surrounding is very important also. And the last one is GABA, or gamma aminobutyric acid. So basically, this is the kind of hormone that decreases our nerve cell activities. So when the activities is slowing down, when it's dark, everything is slowing down. So we are sending signal to our body that, hey, this is time to sleep. These are 4 hormones. There are a lot of other process that's happening, but these 4 ones are the ones that also related to, some of this related to food, which we'll discuss later. All right. So moving on, sleep and disease. We just want to know, like, if you have more sleep or less sleep, what kind of disease that can come with it. And these diseases that I will be discussing, they're all nutrition related, where you can prevent or you can reverse depending on how well you take care of your nutrition. So if you get 5 hours or less sleep, okay, there are a few studies for all these diseases and sleep problems that I will be discussing about. It's based on a lot of multiple studies. Some are conclusive, some are not so conclusive, but we can weigh around our option, like what should we do in order for us to get the best suited way for us to live. So for this one, it says that some studies says that if you sleep for 5 hours or less, you tend to have highest BMI and greatest weight gain in comparison to other people who sleep more hours. So that is some studies says that, and then also another study say that says supporting that previous study. it says that disruption of appetite hormone, your ghrelin. So basically, this is the hormone that induce appetite. When you feel hungry, when you feel like, oh, I really want to eat, it's because of this ghrelin hormone. And versus satisfaction hormone, leptin. Leptin is a hormone that is released when after you eat, you feel you're full and happy and you're okay with this. You're satisfied. So that's because of this hormone. But when you get less sleep, there is a disruption between these hormones. So it goes haywire. Your body cannot tell you when you are satisfied or not, or you might get hungrier. So hence, that's why it can later on contribute to highest BMI and highest weight gain. All right. As you see down there on the third point, I did say that it can increase your ghrelin, your appetite, but then also it decrease your satisfaction. So then you will be consuming high calorie because you keep on feeling hungry and keep on not feeling the satisfaction out of that food. All right. Another one is lack of sleep can also trigger the reward area in your brain. Our brain has a lot of different compartments. So when you don't have enough sleep, there is this certain area, it's a reward area. It will be triggered and you will start to have craving for high fat, high calorie. So none of us would crave for vegetables. The thing that we'll crave for is a high fat, high calorie. So this will further contribute to the highest BMI. So other effects is obviously increased fat storage in your belly area. And then also that will decrease our insulin sensitivity and then overall diet quality and high BMI. So this is how sleep affects our body weight and hence towards obesity later on. Okay, I hope that explains it well. The next one is obstructive sleep apnea, OSA. When you don't get enough sleep, you can gain a lot of weight. So when you gain a lot of weight, you can also have OSA. So what happened during this OSA is that when you're sleeping, it kind of block the airway. This can happen when someone has BMI more than 30. So if you want to know what your BMI is, you can simply Google BMI calculator. And there's a lot of calculators on Google there. And then you can just click on any link. You can use your metric system or feet, inches and feet, doesn't matter. Just plug it in. It will tell you where you are. What's your BMI? What category you are? So if your category is over 30, that's when you should be worried. Even before reaching 30, more than 22.9 for Asians, that means that you should start to be doing something to reduce that BMI. And back to our OSA, the fat deposition in upper respiratory tract, basically all the upper respiratory tract where we're breathing, there's a lot of fats there as a result from our weight gain and a fat deposition. So this kind of a fatty area with narrow airway and decreased muscle activity. So when you sleep, you'll be snoring and it's kind of hard to breathe sometimes. And then the next one is weight loss can improve sleep problem. So basically, if you try to lose some weight, so this problem can definitely be reduced also in the same time. So we want to aim for weight loss. Okay. Next one, sleep and disease with diabetes. So if you look at the previous one, there is obesity and then OSA, and then after that you can have diabetes also from all this as a result of the weight gain. Why? Because when you have high cortisol, which is the kind of hormone that will increase also. It also will increase your glucose and insulin in your body. and that will eventually later on down the road, it will increase your risk for insulin resistance. So we don't want to gain weight and then also have diabetes after that. Okay, so this is some studies say that people who sleep less than 7 hours, or surprisingly, some studies also find that if you sleep more than 9 hours, you are in a category of group of people who have high risk to develop diabetes. So that's why you cannot overdo it and you cannot have too less of it either. All right, the next one is heart disease or cardiovascular disease. So basically, they did a lot of study, and then they found out that 20 to 32 people, those who sleep less, percent of people who sleep less than 6 hours, they can develop hypertension, so high blood pressure. And then if you sleep less than 5 hours, it may even double the risk. So this is very, very alarming because as a Malaysian, we have a lot of salty food. We have a lot of food that made from soy sauce, made from shrimp paste, any kind of paste, any kind of broth. We do use a lot of this in our Malaysian cuisine. So these are the things that we need to be aware about, because it doesn't just necessarily come just from the food, but also from our lifestyle, like our sleep. And OSA, the one that we discussed earlier, that can also increase risk for heart attack and stroke. So if we look at this from a bigger picture, we can see like how all of these are interrelated with each other. All right. All right, now we're getting into food. Okay, a bit more interesting. So those are the kind of diseases that can happen that may increase in terms of their risk for the risk to get the diseases. Now we are looking into food. What kind of food that makes you sleep faster, or what kind of food that keeps you awake, and how does the food affect the whole process in your body? All right, so now tryptophan is a type of protein. Okay, the protein, the small after being digested, we call it amino acid, but we're just gonna call it protein to make it easy for this session. So this tryptophan protein, it will be transformed into serotonin, which is a kind of hormone that makes you feel happy. You feel like your well-being. You feel just nice. You love the day. So, and also melatonin. So why? Because these two hormones affects your mood and your food intake. So some studies says that they show increased sleep efficiency and sleep time, and improve anxiety and depression when you consume tryptophan. So basically, if you eat tryptophan, if you eat this type of protein, it can help in terms of your sleep. All right. So where can you find this protein? So we have obviously meat and chicken. There are protein, but also because they are 100% protein, they have a lot of other different protein or amino acid. So this all kind of different kind of protein in meat and chicken, they have to compete each other for them to be absorbed in our body. So it's not easy for tryptophan to get absorbed when it has to compete with a lot of other protein. So it's not the most effective choice that we can choose. All right. But don't worry, we have other choice. So right here, if you can see, we have mushroom, broccoli, pumpkin seed, soybean, peas. So these are plant-based. So maybe some of you out there are vegetarian. So if you're vegetarian and you want to know that, okay, where can I get it from? So these are the kind of protein that you can get it from. Also legumes. So when you consume all this, you can also get tryptophan from it. But of course, the amount varies depending on what kind of food and how much you're eating it. And another very interesting fact is high carbohydrate food. So have you ever experienced that when you eat a lot of carbohydrate and you get sleepy? So you are trying to stay awake, but then now you're sleepy. Okay, so it's because when you have high carbohydrate in your body, it will of course increase your insulin, because that insulin needs to process your carbohydrate. Um, and then the absorption of the glucose in your body, it will go together with the tryptophan, the amino acid. So they will be absorbed together, and you are not consuming a lot of other protein, because this is a carbohydrate. And it will also later on increase your serotonin, which increase your sleepiness and feeling that you want to go to bed now. Okay, which is why when Hari Raya is coming up, so we eat a lot of high carbohydrate foods such as ketupat, what else? All sweet drinks, all the dessert, all the kueh, all this. This will contribute to for you to feel sleepy after you eat, if you eat in a big amount, more than your usual amount. So even on daily basis, if you just say you're breaking your fast, you buka puasa, and then you have a lot of options around you, and you're so hungry, you're so used to eat rice, so now you want to eat a lot of rice. So when you after you eat that rice, you just feel very sleepy throughout that night after you break your fast, like even way before your normal sleep time. So that's all because of the absorption of the tryptophan. It's very effective if you consume it from carbohydrate source. All right. So if you are planning not to fall asleep, then you have to manage the amount of carbohydrate that you're taking, so it balances out with a lot of other nutrients, macronutrients, your protein, your vegetables, so that you don't just fall asleep soon after that. Yeah. Okay, so that is tryptophan. Now we're moving into protein. So speaking of tryptophan just now, it's quite everywhere. It's in carbohydrate, it's in your protein, but in the protein, it has to compete with many other protein. So there are studies that says those who sleep less, they tend to have low protein intake, and they tend to consume more carbohydrate. So when you sleep less, there's a lot of alteration that's happening in your body, and the tendency to want more carbohydrate is more. So this is when it can later on contribute to weight gain also. Also, another study, interestingly, it says if you consume like your overall total diet, if it's less than 16% comes from protein, you would more likely to have difficulty to fall asleep or poor sleep quality. But also, if you have more than 19%, maybe about like 20%, you also will have difficulty to maintain your sleep. So you have to have the amount that you're eating, it has to be in the right range of amount. So not abnormally too less or too much. And why we talk a lot about the tryptophan just now, and why? Because it is the precursor to produce melatonin. So tryptophan, it will convert into serotonin. This is your hormones, and after that, it will go be a melatonin. Then it can help you to fall asleep. All right. And what about fat? Oh, speaking of protein, you want to look into, this is a little bit of protein example in the picture. What are the food that we consider protein? Well, except for the fruits in the picture, but the rest are all protein. If you look at nutrition facts, let's say you're eating something just out of the box that you just bought in the grocery store, and you want to know how much protein per serving. So if you look at this label, this specific food, it has 4 serving per container. It means, and then serving size is 1 cup. That means in one whole container, it has 4 cups. But you are drinking 1 cup. So the nutrition label here will show you what is that 1 cup like. What is the nutrition content for that 1 cup that you're consuming? So let's say you want to look into protein, how much protein in this one. It will be all the way down there, bolded, protein 15 gram. So you know that, okay, if I drink 1 cup of this, I have 15 gram of protein that I absorb. Okay. And the next one, we're looking into fat. And this is the most important part of the discussion, because some studies says that if you consume high fat or saturated fat, to be specific, you tend to have shorter sleep at night. And then it also negatively impact your sleep quality. So if you eat something off the shelf, you can look at where is the saturated fat at. Basically, if you look at the screen right now, it has total fat on the top and then bolded. Under that total fat, it has saturated fat and trans fat. Okay, that just kind of say that saturated fat plus trans fat plus any other fat that is not written there, the whole total of everything is the one that's up there, total fat 9 gram. But you want to know what is the saturated fat, because if you are comparing brand A and brand B, you want to make sure that you choose the brand that has less saturated fat. Okay, obviously we want less total fat, but saturated fat is the one and trans fat are the two type of fat that we really want to reduce in our diet, because they have really bad complications later on in your life. So part of it is also negatively impact your sleep. So if you look at that in the picture there, saturated fat is 4.5 gram, meaning like out of the whole total 9 gram, 4.5 gram comes from the bad fats. All right, so just remember, when you choose your food, make sure that it has the low amount of saturated fat. All right, next one, sleep and carbohydrate or sugar. Because carbohydrate, when it's digested in our body, it becomes sugar. The sugar that we're eating, it's already in a simple form. It's just digested right away. So what does the study say? It says that high carbohydrate intake may decrease sleep onset latency. Basically, in a short form, it's a time taken for you to fall asleep. So if you eat high carbohydrate food, you will fall asleep faster. If you eat low carbohydrate food, it takes a lot longer for you to fall asleep. Okay, and which kind of reflects to the situation that we discussed just now, where if you eat a lot of rice, go to any Hari Raya open house, then after that you feel sleepy and tired. So that's part of how it happens. Obviously, the presence of tryptophan. So now you can use this as something to help you to fall asleep, or it can also be a problem when you consume too much in the middle of the day and then you actually have a lot of work to do. That's another problem. Okay, and high sugar intake is associated with short sleep, less than 6 hours. So some studies says when people tend to eat a lot of high sugary food, they tend to sleep less than 6 hours. And then that contributes to sleep deprived. And then that contributes to another high consumption and then weight gain. So it's like a vicious cycle that is quite hard to break. So that's why you have to start somewhere, either modifying your choice of food, and also in the same time, make sure that the sleep hours is appropriate. All right, so now we want to know what are the food that can help us to sleep, because other than carbohydrates, because obviously we don't want to just be eating carbohydrate when we want to go to bed. So we want to know what kind of nutritious food or healthier options so that can possibly help us. So food that high in phytonutrients and antioxidant has been there have been a few research that said this kind of food can improve sleep duration and quality. The two most popular fruits that they have been looking into is a cherry and kiwi fruit. So according to a lot of studies out there, it says that this cherry and kiwi fruit has high antioxidant and phytonutrient. So if you want to fall asleep a little bit faster at night, maybe you can try to consume this a bit like 1-2 hours before you go to sleep, but obviously not in a big amount, because if you are a diabetic person, if you have a diabetes, you are going to have another problem where it's going to be high blood sugar after that. So you want to make sure that if you are eating fruits, even though it's healthy, but you want to make sure that it's within the right portion. All right, so now it's our last point of the talk, take home message. So what you need to do in order for you to have a balance, a proper sleep time, a proper nutrition and diet without gaining weight. So first of all is always having a balanced diet portion. So, but if you have specific needs, obviously some people would need specific food at certain time, or maybe supplementation, depending on the assessment after seeing health professionals. So obviously these people are considered special cases, and there are special needs that we have to pay attention to. And also 7 to 9 hours of sleep is the average for adults, so that we can make sure that we don't turn our body into a cycle where we are lacking in sleep, and then it contributes into weight gain, it contributes into craving, and then lack of sleep again. And then after some time, all we know, our BMI is already 40, which is something that we really, really want to avoid. All right. Let's see if we have any question? All right, so I'm actually looking at a question down here. Okay, there's one question that asks, hi, some people claim that we should not eat before bed, but the other side would say it's not a good idea to go to bed hungry. How would you advise it? Okay, first of all, our meal time, we want to make sure that we have a proper breakfast, lunch, dinner. That's minimum 3, but we want to have snack in between, because that's how we manage our appetite. So you can eat before bed, but there's always a but. You have to ideally you want to stop eating 4 hours before bed. But you have to look at your work schedule. Some people work, they get home so late, and then they only have 2 hours before bed. So you either have to plan to eat before that, or you have small snack before bed. And yes, you should not go to bed hungry, because your body will be fasting throughout the night. So if you're sleeping for 7 to 8 hours, so that is when your body has nothing. It will be on a fasting state. So when you wake up, you will be so hungry to a point that you will eventually overeat, or you will try to starve yourself when you feel guilty when you overeat. And that will lead to a lot of other problems down the road. So the best alternative, the best idea is to have your dinner 4 hours before sleep. But if you have snack, you can have a small snack like a fruit or a glass of milk. You can have that 1 hour before sleep. It's fine, because it's not something that high in calorie. So we're not talking about KFC or McDonald's or Mama in the middle of the night, which that will definitely eventually cause weight gain. Because the point is, if you eat too close to sleep time, and if you're eating a big calorie, the calorie that is being consumed is stored in your body throughout your sleep time, and that can later on leads to weight gain, because we're sleeping, we're not using the energy. So that's why we try to eat big meal 4 hours before sleep. If it's a small meal, you can have healthy snack like about 1 to 2 hours before that. It's fine. But there are some people who have GERD, basically the acid in the stomach can come up if you lay down. So that is another reason why you shouldn't eat so close to your sleep time. Because when you eat something, everything that you eat needs to be digested, and all that hormone, all that acid in your stomach can go back up if you lay down right away. So that is another reason you need to space it out a little bit, and you need to make sure that you have your dinner 4 hours away from it. Okay, I hope that answers the question. All right, from another question that, hi miss, drinking milk or soy milk before bed would have a good sleep. Okay, so since you are drinking only 1 glass of milk, and if you don't have digestive issue, then it's okay to have it, and then it can, maybe the tryptophan in the milk can help you sleep a little bit. And also you're not too full, you're not too hungry. So just make sure that you don't have acid reflux that's happening. That's the only concern. And then, let's see. I need to see this. Okay, what is your advice to someone who suffers from sleep apnea? Okay. First of all, with the OSA, if you have difficulties to breathe, usually it comes with weight gain. Our body is already, so we have gained so much weight, and there's a lot of fat in the area inside, as I explained earlier. So in some ways, it obstructs the airway. So if you go, obviously, first thing first, you have to go see a doctor where they would assess you, and they will provide medical treatment. But also in the same time, it has to be combined with the effort to manage your weight, because medical treatment by itself, it can help, but it's not overall complete solution. So you need the medical treatment from doctor, and also you have to have an effort to lose that weight, so that it kind of go hand in hand. Just like diabetes, you have to have your medication and also your diet combined together. You cannot just pick one and go with one. So I would advise that have a visit your doctor, and then your doctor will give you different treatment depending on the assessment that they do. And then after that, from the nutrition point of view, definitely we would recommend a person to lose weight, so that you can also lose your fat percentage in your body also. All right. Let's see if anyone have any other questions. I think that's all the questions that I have. So if anyone have any question later on, something that just pop up in your head, feel free to drop a message, and then we can always get back to your question later on. I hope that the talk really benefits everyone, and then now we know like why sleep is very important with your nutrition. They actually go together. So it's your lifestyle modification. So I hope that everyone can start to have a great mindset and great new practice in 2021 maybe. So everything is new these days. So we got our COVID vaccine, and now maybe you want to change your life, you want to change your sleep time, your food. So this is the time to get into a healthy habit, and hopefully it can benefit everyone. And maybe I'll see you in next talk if we have. So thank you for attending the talk, and I hope that it helps. And yep. So have a happy afternoon, and see you soon.